Previously, I talked about how the Pfizer and Moderna vaccine use mRNA. mRNA is very volatile and is typically stored in very cold temperatures. Pfizer's vaccine must be stored in ultra-cold fridges at -70 Celsius or -94 Fahrenheit. That's Antarctica temperatures. Moderna's vaccine is more stable and can last for 6 months at -20 Celsius or 30 days and around 5 degrees Celsius. The AstraZeneca vaccine doesn't use mRNA and is likely the most stable of the three. It would likely require refrigeration, but not at freezing temperatures. The takeaway is that it will be a challenge to distribute the Pfizer, and to a lesser degree, the Moderna vaccine, especially to rural communities. In terms of when these vaccines will actually start to be given out, the answer is soon and likely will start the third week of December. Currently, Pfizer is in the process of receiving an emergency use authorization, also known as an EUA. Basically, it's permission from the US government for Pfizer to give their vaccine to people. EUAs are only given out if a disease really needs to be managed and the vaccine seems promising. Mark your calendars for the second week of December. That's because on December 8th, 9th, and 10th, there's going to be a meeting for the Advisory Committee on Immunization Practices. The ACIP committee is part of the CDC and provides advice on vaccines for the US population. They've reserved December 8th, 9th, and 10th to review the vaccine trial data and will likely have an initial decision within 1 or 2 days of meeting. We're not sure which vaccines they'll be reviewing, but it's at least the Pfizer one and possibly Moderna as well. One last thing. All the current trial data is for adults. Pfizer, Moderna, and likely AstraZeneca have either started or will soon start looking at trials for children. Pfizer, for example, has started planning trials for children as young as 12. I hope you're enjoying and learning a little bit from these brief videos. There's more to come.